designed to be able to maintain either positive or negative pressure. This is something that if you have an interest for positive pressure, pay attention before you place your order. I've seen a lot of devices that maintain negative, but not necessarily both. This one is actually well engineered because with the same equipment you can produce both environments. With the package, you will receive two fans, two batteries, two battery chargers. One thing that we have not done yet is to test how long the battery lasts. I would say, on top of my head, at least a couple of hours, but we have not actually run one until we deplete it. What we have done though is to ensure that one fan maintains sufficient airflow for somebody to be comfortable inside and breathe. So you have two fans, two batteries, two battery chargers. In terms of the positive negative pressure, on one side you put a filter, and the entire concept, the way to get either positive or negative one is simply to play with the fan and where you put your filter and when the air is going in and out. So this is your fan, it's battery powered, gets in, air comes getting sucked in, then pushed out. So if you want to maintain negative pressure, you want to take the air out. So you put your filter here. Right. In our case, we want to maintain negative pressure. And there it is. It's kind of dumb-proof because the way that the duck and the male and the female works, you cannot get it wrong. So now we are maintaining negative pressure. Any question on that before we carry on? It's very simple.
Either, so obviously there's a seal.
Yes. I'm going to get
Yeah,
that.
no, sorry.
Can that not work while it's plugged in or just off the battery?
No, it's off the batteries. That's why it's, if you have, it's important that we run those tests about the life the charge of the batteries to know how long it will last. If you run both batteries for multiple hours, you run the risk of both batteries running out at the same time. So in terms of the device itself, it's quite simple. As you can see, this is a small device. Go on the market, look for size. You may find size that are a bit broader, higher. It's a trade-off. I understand that your interest is not for air medevac, it's mainly for transportation into an ambulance. So you may not have the same constraint in terms of size. Because to fit this into small medevac plane is a challenge, especially when you have to turn the turn radius and you have to clear the door. So you may want to have something bigger that people will be more comfortable. You'll have more space for making procedure on the patients. On the other side, you may not be able to fit it into the plane. It's a trade-off. This one is actually a not bad middle ground between more bulkier device or smaller device.
So weight limit on it?
They're not tested. The weight limit of the people is designed to be able to be lifted. I would not go far. Okay. So in terms of moving somebody from a stretcher to a bed, yes. But don't start to move around really low to far. There's a few reinforcements, but the reinforcements are not very comfortable for the patients. So the device itself, there's a zipper that you can zip to maintain potentially. You have a number of ducts for make procedure, two on the side, two at the end. Standard stuff actually, literal gloves. Before I go further, decontamination. There's a procedure for decontamination in the manual, the user manual. It's extremely thin. So we are on our way to ship one to the NML to be able to do more testing on decontamination. But until we have clear evidence that it can be safely decontaminated, all concept of operation is one use only. There is so few right now. Well, we're receiving a new batch this week, but we had so few that we probably would not have destroyed it, would have decontaminated as much as we could, put it aside, put a big tape on it, and not use it unless you're really in trouble. But that's what we are. It's about $5,000 buy. So to go in, I'm not sure if there is volunteer, because the space of this, when you put somebody inside, you don't have much room to do any procedure on the patient. And sorry if I'm just adding stuff here. Actually, we put some thought on under which operational conditions could we move a patient using airway evac in such a device. And clearly, because of the size limit and the constraint for making procedure on the patient, you do not want to have a very, very long, maintain a patient in such a device for a long period of time. That was important to us because last fall there was no firm airway evac solution from West Africa to Canada. So we wanted to know, could we use this? The answer is no. We would not use this for airway evac from West Africa to Canada. It's too long. To maintain a patient in that, you run the risk that his condition deteriorates and you don't have a lot of ability to be able to make procedure. If you have a wet patient, it will be nasty. So you probably want to move the patient as soon as you can. We just cannot envision having a patient intubated inside.
So there must be other products that they are using for that scenario, the longer transport?
Yes, there is. And the solution to that is not an isopod, it's an iso chamber. This is what Phoenix Air is using. This is what you probably have seen in repatriation from West Africa. So basically, instead of having the patient into an isolation device, you've got an isolation chamber into a transportation means, a plane or vehicles, and inside that chamber you put the patient and the healthcare worker with full PPE, and that's where they give care to the patient.
So have you done some math to say sort of what your comfortable limit is for transport by time?
Will be it's based best on expert opinion, and basically we said 3 hours. So if you run 3 hours, we're comfortable. It always depends on the condition of the patient and how far they are in their disease. And again, this is not science based.
Coming out of Sydney, then you'd be
Yeah, that's right.
challenged.
Yeah.
I just want to mention, I said 3 hours because this is what the round number that we landed on.
Yeah.
There is no
Concrete
hard scientific evidence for that.
So somebody gonna jump in?
We have a volunteer.
What am I gonna do?
I want somebody who's actually going to have to use it. I mean, my scene, whatever it's like.